Pennsylvania nurse practitioners have been pushing for full practice authority for many years.
Yeah, it is another health story tonight, and it takes us to Harrisburg. Erie News Now State Capitol correspondent Brendan Scanlon explains what it is and has reaction from nurses. Brendan, good evening.
Hey there, Mike and Eva. Good evening. Well, currently, nurse practitioners are required to practice under a collaboration agreement with a physician. Nurses say one of the best ways to explain it is like having a permanent student driver's permit, except instead of a licensed driver in the passenger seat, it's a physician who is essentially required to oversee, again, how that nurse practices at all times.
I don't need somebody sitting in my front seat telling me what I need to do anymore.
Pennsylvania nurse practitioners are looking to cure what they call an antiquated law.
Currently, we have to have 2 collaborative agreements, 2 legal documents to practice to the full extent of our education and training, which are cumbersome.
Nurse practitioners like Cheryl Schlam say it limits their ability to care for patients, especially in underserved communities experiencing a primary care shortage.
80% of us do primary care, and sometimes in areas where you can't really get access to care, whether that be rural and sometimes inner city areas.
Let's get these 18,000 nurse practitioners in Pennsylvania up and ready to do what they do best.
Senator Camera Bartolotta is the sponsor of Senate Bill 25, which would give full practice authority to nurse practitioners. 27 other states already granted, including many of Pennsylvania's neighbors.
Right now, we see a huge decline in our highly qualified nurses. They're moving to other states, especially other states that are around Pennsylvania. They border us and they offer full practice authority.
The bill would require a 3-year, 3,600-hour collaboration agreement with a physician before nurse practitioners can work independently. But some physicians say there's no need to fix the current system if it isn't broken.
A lot of the current models that we have for care work.
Pennsylvania Medical Society President Dr. F. Wilson Jackson believes patients benefit from collaboration with a physician.
What we have concerns over is the independent authority that they're seeking. We feel that patients' care is optimized when there's a physician as part of that care team.
Mike and Eva, Bartolotta's bill has broad bipartisan support in the state Senate, where it has passed in previous sessions. However, it's getting it through the state House that could pose a bit of a challenge. We'll have more details on our website, erienewsnow.com. Mike, Eva.